Hi, good morning, everyone. Hope you all are having a very good day today. Okay, today is it's Friday, and it's going to be this Zoom session today. I'm going to speak about, we're going to share and learn a little about cancer. Okay, so generally, cancer, I'm going to present more on female cancer. The next week will be on male cancer, and then we'll go on. Okay, so I hope you all are having a very good day today. Okay, so get ready your coffee, and let's get into the presentation of cancer. All right. For those, please use the chat bot. Put in your info, questions, anything. If you all have on the chat bot, keep the chat bot lively. And okay. For those who are viewing in YouTube, you may type your questions there also. I'll get the message. I'll try to answer as much as we could. Okay. All right. This is something that, cancer is something very alarming that a lot of people request for this session. So we got to understand. In fact, cancer is nothing. If you were to detect earlier, cancer is a disease where you were able to, have a healing or cure in a very, very early stage. Okay. So this is what it's all about. But then most of the time when they get to know cancer is the very late stage, and a lot of people are not aware that they have one. So I would say this is because they are not keeping, really healthy, or lifestyle is so difficult nowadays. And disease is something that is coming, too fast. Okay. The reason is we are in a very, very toxin world, and also extremely malnutrition. Okay. So the food may look good, and but we're not getting what we are supposed to get from the food. And furthermore, they are topping up with a lot of toxins, which just is compressing the system, the immune system, and really making the body to suffocate. Okay, so let's go in. Okay, before that, okay, my name is Dr. Firdaus. I'm a medical doctor, emergency physician. So now what I'm doing is I'm doing more on lifestyle coaching, teaching people how to obtain a good health in an easy way, by also doing integrating my practice with DXN. That DXN is, I would say, is a revolutionary product, or it is really helping a lot of people. Okay, what is cancer? Okay, cancer is an uncontrolled or abnormal growth of cell, where the cells are keep growing, which is unwanted cells. Okay, this is the cells we are not supposed to grow in our body, but due to the system, or we are so much with toxins, and the system is very acidic, close to acidic, and all this is what is making a lot of unwanted cells to keep multiplying and growing. And suddenly one day you see, and there is a lump, and that lump is a cancer. If they were to have any little lump internally, you may not know. You see, suddenly you see something is bulging, or you have some difficulties, pain, and this and that. And that's where when you go to the hospital, you get an examination, then suddenly you get a shock that it's a cancer cell. So there are many types of different types of cancer cells, but that is not important. Today we are just going to cover in very simple what is cancer and how you're able to prevent this. Okay. You see, this pH chart is something that everyone has to know. Okay. And we heard about this. Some may know and some may not know. You see, our body has a different pH standard in every area or every organ. But you see, a lot of people say the body could be very, very acidic, but normally our body will never go into acidic. The blood will never go into acidic. If the blood were to go to the acidic, that is extremely dangerous. Okay, so it can be close to acidic. Okay, you see the pH chart, 7 is neutral. Okay, we are supposed to have an 7.5, 7.25, and that is what the arterial blood pH could be. But what to do? There are a lot of people's habit of eating habit is so bad, and they are just I would say like dumping in food too much, eating very irregular, are not responsible, and most of the time they do not know what they are eating. You see, today I went for a fitness training course, a short course. Even there, people are not really aware what is really good, what is not good. Everybody seems to thinking that flour is good, bread is good, cookies is good, oats is good, and all these things. So, but at the end of the day, when you take something, your body looks for nutrition. At the same time, you are eating very highly acidic food. This can keep or push up your acidity level in the body in many, many ways. Okay, so the acid-base balance refers to a mechanical of the body used to keep its fluid close to neutral. Okay, it has to be close to neutral, but what is happening in it is getting close to acidic. So when it's getting close to acidic, this is where the body has to use a lot of the nutrition in the system, minerals, this and that, to push it back to alkaline or neutral. Okay, the arterial blood pH is normally close or regulated to 7.35 to 7.05. But what happening when the system, when you have a blood which is 7.01, that is not good. So the body will push it up back to 7.35 or 7.45, and that is a lot of nutrition which you are losing. And this is where there is also people who are having like 6.99 arterial blood and all these things, and this is very, very alarming. Okay, this is not good. It's not a healthy lifestyle. This is what happens. Okay, so common cancer. Okay, a cancer factor of a woman. Today we're going to cover most of the woman cancer, and very, very simple presentation today. I'm not going to go into anything very detailed. Okay, we are here not to learn about science, just basic info, how and what we can do to keep ourselves healthy and away from cancer. Okay, some of the cancers are the most common in women. Breast is one of the most people get, and which is also talked about. Colorectal, endometrial, lung, cervical cancer, and ovarian cancer. Okay, and nowadays we see that a lot of young and very, very early stage people can get this cancer. This is what is so scary. It's very, very scary. You see, WHO statistic, they says in another 7 to 8 years, 70% of the world population is going to be cancer, and 90% is going to be diabetic. But isn't that very scary? Yes, 7. So it take 10 out of 10, 7 will be cancer. And in fact, this is what is happening back in hospitals. The cancer departments is so crowded, and the statistic is spiking up. The juvenile cancers is also equally worst or bad as the adult. Okay, so what is really happening? But isn't that we are in a very modern technological world? Medical is so advanced, and so this and that, everything is happening. But why? Diseases are getting more, and we cannot manage the disease. Yes, medical has been advanced. That's definitely sure. We have different types of equipment, device, this and that, everything we have. But the problem is, the food industry is so bad. The food what we are taking is so much contaminated, and all these reasons is making. Okay, so go to this the stage of colon cancer. You see, in cancer we always have stage 1, 2, 3, 4. Okay, the stages is based on the size, or either what is the radius of the cancer has spread. This is where they measure. Okay, if say we were to have anything to do with colon cancer, and the stage 1 is just in between or in the wall of the cells. You may have a polyps or anything which is not really been aggravated or not hit the third layer of your, the colon. And that is where the second stage, where it goes to the third layer of the colon, and then in the stage of 3, it really hits the nerve, and then stage 4, it can go up to the other areas of the body, okay, which is like lymphatic system, lymph nodes, and all these things. Then that is becomes stage 4. And stage, why we cannot cure, chances of survival is so slim when the stage 2, stage 3, or stage 4, because the cancer tends to be very active, very aggressive, and is ready in many areas or other organs. So this is why, okay, most of the time we find it is very challenging to reverse or to do or help anybody who has stage 3 and 4. Okay, got to look at this female reproductive system. Okay, cancer, all the cancers are the same. Okay, we have many different types of cancer, but all these cancers are the same. It is not anything different. How the cancer cells work, how the cancer cells react, it is the same. But when it grows in the ovary, then it's called ovary cancer. The uterus cancer. If it is in the lungs, you call it the lung cancer. If it is in the skin, you call skin cancer. So this is how the female reproductive system is. Okay, fallopian tube, ovary, uterus, comes cervix, endometriosis, vaginal wall, and vulva. Okay, so uterine cancer is uterus cancer. It comes in the location where near the uterus, and then it grows. It goes to the wall of the other part, the reproductive organ, and it also can spread to other organs such as your fallopian tube, your cervix, or the other areas. This is stage 3. And when it can go up to out of the reproductive organ, and that goes to stage, it starts to spread more, and this is stage 4. Okay, and what kind of symptoms and signs you can have? You normally in the stage 3 and 4, you may tends to have some bleeding or discharge and all these things. Very rare we have any sign and symptoms as stage 1 or 2. Okay, very rare. Okay, unless coincident you were to do some pap smear or something like that, then you may able to spot in the very early stage. Okay, so endometrial cancer, this is where the in the wall of the endometrial, there the abnormal cells will start to grow, and then it'll keep growing until the endometrial wall, or either the whole area is become unfunctionable. Okay, this is where the cancer comes. The sign and symptoms here is also pain with bleeding. Then colorectal cancer. Okay, sorry, there's an error here. This is lungs cancer. Okay, lungs cancer, stage 1, stage 2, 3, 4. Okay, it is still the same. Whenever you have any lungs cancer in the stage 1, you may not know at all. Okay, you cannot know. There is no any signs and symptoms. Even you can normal breathing, you're walking, you won't be panting, and nothing will happen. Okay, that goes up to stage 2. The stage 3, there will be a little. Then stage 4 is where you will know, and that is the time it will be tends to be a little late. Okay, so not only the smokers can get lungs cancer, but the non-smokers too can get the lungs cancer. Okay, so cervical cancer. Okay, this is where the cervix area. Okay, the cervix area, this is where you tends to grow, and it can grow very big and large, and it also, the sign and symptoms is pain, and only in the stage 1B, which is late of 2, and then it goes to the 3 when urine or anything, that you might feel a little of sensation, but you may not really feel anything. Okay, and that will be some bleeding at the stage 3 or 4. Okay, and this is skin cancer. This is how it looks like. Okay, and sometimes it looks like a mole. And this is where a lot of people, even the mole can become a skin cancer if the mole tends to grow or itchiness and all these things. It's advisable to check. Okay, this is very difficult to explain, and there are many types of skin cancer which has been spotted. It is not necessarily has to be black. Even it can be like what you're seeing in the screen, and that even can cause, skin cancer. Okay. Ovarian cancer. Ovarian cancer is something that, it tends to grow in your ovary. Okay, it tends to grow in your ovary, and this is also where you may not even get bleeding for this cancer. Okay, the bleeding, it will never flow back into your reproductive organ and all. No. Okay, this is where it will come pain associates. You only can have pains in the stage of 3 and 4, but that is pretty late. Okay, so this is where most of the time ovarian cancers is only been detected in the stage 3 or 4. So this is very, very dangerous. Okay, what we always recommend is regular ultrasound, or based on your lifestyle. If you're having a very bad lifestyle, very poor, or you have a family history of cancer, it's always good to have a regular ultrasound, maybe like 6 months once or 1 year once. That will be much better. Okay. And ovarian cancer is the stage is also the same: stage 1, stage 2, stage 3, and 4. Okay. Okay, the most spoken about cancer, or the broad topic, which is breast cancer. Okay, this is very, very aggressive, and breast cancer is the most common in women. 1 million women dies due to breast cancer each year. Okay, this is where they are creating a lot of awareness, the regular check, and this is really needed for breast cancer. Okay, even now the healthy ones, but the difficult part is, how when a lot of people claim they are very healthy, but in what way they claim healthy? What is the definition of healthiness there? Okay, absence of disease, or either in shape, or either you are slim, or you are active in sports. What make people to claim that they are healthy? These are the factors they claim. People think they are very slim, they are healthy, active in sports, they are healthy, this and that. Okay, but this is something that very difficult to explain. Okay, but I haven't seen that very healthy ones get cancer and the non-healthy ones do not get. And this is where at times, being a doctor, the people come and ask this question: Doctor, I've never done anything bad, so this and that, I'm so good in my food, I'm so really take care, I do regular exercise, why me? See, there's something that's very difficult to answer. Okay. All right, breast cancer in the age, when you really need to check. Okay, not only for breast cancer, any cancer, when you reach 40 and 44, go and get your routine checks. This is very much advisable. Okay, ultrasound, any kind of scanning or whatever is available, please go and do. Okay, 40 to 44, X-ray for lungs, and even now for cervix we have ultrasound, internal cameras and this and that. Please, if you have that facilities, if you can get it, is always advisable to do it. Okay, women age of 45 to 54 get a mammogram every yearly basis. Okay, this is advisable. Even now doctors are telling that if when you have a cancer history in the family, uncle, auntie, anything like more than 3 to 4, okay, level of your relatives you have, the generations, even 6 months once is advisable, or pap smear, mammogram, and all these things. Okay, for women, anyone age of 55 and older, okay, 2 years once you is advisable, but also okay if you can do it yearly basis. Okay, so after the menopause time, that is even more difficult. That it's very difficult to say that after the menopause also the high risk is still there, because hormonal imbalance, a lot of things comes in. So it's also advised after the menopause to have a regular check. Self-examinations also, it is really encouraged, and every week or every week once, when you're taking a shower, please do palpitate and see around the breast there is any abnormal growth. Not only the breast, even on the shoulder blade, on your armpit, groins, and every area. See where is any abnormalities. Your back, lower, here and there. Sometimes can have lumps and bumps that you may not able to see. Okay, normal. So you have to play around, see, put your hand up. I believe that you all know how to do this examination. If you don't know, please Google. Okay, please Google. See, there's so many videos been out there, and this is something that really important, because the stage 1 and stage 2, the chances of curing is very high. Okay, don't come at the stage 3 or stage 4. That is where everything goes haywire. Okay, and what are the signs and symptoms of breast cancer? You see, lumps is common. Okay, normally you will have lumps, and nipple discharges also, but that is not in stage 1. Okay, so even the lump at stage 1 is very difficult. If you were to have a big large breast, difficult to spot lumps. Okay, if it is a small one, then it's a pretty easy and more easier that you could able to see. Okay, so do the self-examination. This is what I will say. Okay, nipple discharge is also there, and then dimpling is something that like when you have a lump, it is round, and dimpling is like it'll go inwards. Okay, inside. That is also, this is a tissue damage. That is like something that is a drop in the lymphatic system. This is where it will cause dimpling. Breast nipple pain. Some people will have pain, even itchiness. Some even will have signs and symptoms of blisters, or even you can have dry skin on the nipples. All this is also an indication of and it could be breast cancer. And nipple retraction or inversion, it will go inwards, inside, and that is also another big sign and symptoms of very early stage of cancer. Redness, you may have redness, or either you feel that part of the breast is very hot. Okay, that is what it's redness. If you don't even feel redness, you can't see anything, it just touch and you see it'll be very warm or hot. Okay, this is also another sign. Okay, and change of skin texture. Okay, you can see a lot of sign and symptoms where you can see the skin textures has been changed, or either has gone little darker, or red or darker. Lymph nodes changes, you can see some kind of like dots and like bubbles, or either you can obviously see below your armpit enlargement of lymph nodes, and it's very painful. Enlargement of lymph nodes is very sharp, breaking pain. Anything like that, please look for help. Swelling, the whole breast can swelling, and then it also comes with pain. It associates with pain. See, the lymph nodes is one area where it is a very important anatomy in our system, where the lymph nodes is where it travels a lot of things. Toxins travels through there. The immune system depends on the lymph nodes. So enlargement of lymph nodes, and these stages, when you go to the last stage, this is where it travels. The cancer cells can travel in the lymph nodes. You see, the immunity is in the lymph node. The lymph node is where the white blood cells and all these things travels, and it keeps your system very, very strong. If you have a system which is not strong, which is flooded with toxin, and the whole system is being compressed, okay, and this is what will make your immune system to malfunction, and that is where the cancer cells can go and mutate and start to grow any part of this body. It's any part which is weak. Okay, this is what happened. So the last stage, which can be 4, 3, or 4, this is where the lymph nodes will travel and go up to any other areas, even the lungs, or you can go to your liver, or you can even go to like pancreas and all, because this is where the organs are very close to each other. Okay, this is extremely dangerous. This is where stage 4 comes in. And this is a couple of pictures. This is how a breast cancer patients looks like. Okay, and you see this is the inward, the nipples will gone in, and this is what it calls inverted nipples. Okay, both the side. Generally, when you get cancer on one side of the breast, high chances of another side of the breast to be having cancers as well. Okay, early detections, we treat the whole body with the proper treatment. Okay, if you come to the treatment side, what are the treatments we have? You see, there is only one surgical intervention, and then chemotherapy, radiotherapy, and there is the only method we have in hospital. Okay, a lot of people have this misunderstanding that chemotherapy is not good, bad, and this and that. But it depends on the scenario. If your body is really strong and good, all these may work. The problem is the system is not good enough. You are not strong enough. And how do you expect to have a recovery? Even a surgery is done, your system is not really good and not really strong. You don't have a good mass, good blood, and nutrition is not there. Obviously, you're going to have a great challenge coming out of the cancer. If you go to do a chemo, all the cells are going to be wiped out. All the cells has to regrow again. But the problem is, which cells will grow much faster? Obviously, the cancer cells can grow much faster than the normal cells. Why? Because you have not adopted any lifestyle changes. You have not eating anything good. There's some patients, they will do everything, but the hospitals do not give them a proper diet planning. Okay, they will give the Western diet where eat, like a masala. Okay, eat like a European, and that is where everything goes wrong, and your body remains as it is, and this is the side effect. This is why most of the time we hear that cancer patients have recurrence of cancers, or either after the chemo, they are having a very bad time of recovering from it. Okay, this is what all happens. Okay, you have to remember something, that any sort of treatment you do, if you do not have a good body, do not have a good blood flow, you do not have a good nutrition, the fat is not enough, protein is not enough, you are not going to have recovery. Anything. Okay, so the recovery is in your hand. All right, we doctors, we manage disease. I always tell in every of my talk, we doctors manage disease, we do not cure them. We help the body, but we help the system, and you got to nourish the system and help the system by adding in the right food, and that is where the recovery comes. It is more to a scenario where both the parties has to work, especially the patient. Okay, you got to know this is toxin shock syndrome. Why I asking you to know this is because most of the patients have great toxin accumulation in the body. Okay, high fever, frequent fever, body is overheat. You always feel your body is heat. Even in raining weather, or the weather is really cold, the aircon is in the 16, but still you feel your body is so warm, and you feel like the aircon power is not sufficient, and all these things. this is what happens. Okay, vomiting or diarrhea, frequent vomiting, nausea feeling, diarrhea, frequent diarrhea, very sensitive with food tolerance and all these things. Your body is extremely toxin. This is where you call toxin syndrome. Okay, headache. If you have headache more than 3 times a year, that is considered bad. It's not a good sign. And most probably you are having a very bad digestive system or constipation, or either you have an toxic body. Okay, and redness of your eye, mouth and vaginal area, dryness also, white discharge is also another sign and symptom of toxin. Okay, itchiness, and also pain. Sometimes a lot of patients come with, always asking why they have pain, sharp pain after intercourse. This is also another issue of toxin. Okay, back pain, muscle pain, very bad pain. They are constantly, frequently, they have this pain all around their body, especially the lower back, the shoulder blades, the nappy area on the neck, and the spinal area. Okay, this is common. If they were to do any exercise or exaggerate a bit on a certain targeted muscles, the recovery is extremely slow. It might take more than 7 days or 10 days. All this shows that your body has a toxin syndrome, which we can also say that your alkaline and acidity balance is not really good. And also you may have low pressure or even high pressure. Okay, both can take place here. Okay, so sometimes you see the women always have low pressure. Okay, food is the most tempting. It looks good, so this, so that, all. So colored food, processed food, and all this stuff is so bad for cancer. And always people have this idea that cancer cells live on sugar. Okay, that is not really correct. That is wrong. Why? Every single cell live on sugar. Okay, remember that. Cancer cells is nothing abnormal compared to the normal cells. Both the cells are the same. Both of the system, that's how they live, that's how they work, how they eat, and all the same. Both cells are same. Both cells will fight to live. Okay, but the thing is, the cancer cells is unwanted cells. By the normal cells, they have a purpose to live in the body. So both the cells are living. So how are you going to minus the cancer cells and make your normal cells to grow? That part where the immune system knows about it, and only the immune system can do. What, as a cancer patient or any disease, what you got to do is you have to support the body to grow the good immune system. And when you have a good immune system, the immune system will get rid of the unwanted cell. It is simple. Okay, it is very simple. The out there in the industry, which I see, they have so many different mumbo jumbo, this and that, so much of information is making people afraid and lost in the informatic world out there. And this is where it is so scary. Okay, cancer lives on this, cancer lives on that. This is how the modalities you need to do. There's some, even the cancer associations, and I've been they have like 12 pillars, this modality, that modality. They make so much difficult things. Okay, these are the types of food where people love. Okay, when the healthy one claims this is healthy, the non-healthy also eats like this, because they have many reasons to eat like this. Okay, fried chickens. Okay, low quality, using low quality of flour, oil to fry them, and all. Okay, and sugar usage is too much, processed stuff, low quality butter, and the fly is so bad, and all this is carcinogenic. Carcinogenic means it is a cancerous type of food. The bread and cookies that people are eating is also equally bad, and which is carcinogenic food. Okay. Estrogen and progesterone cause craving. You see, when you take all this kind of processed stuff, when you take meat which is processed, especially chicken and chicken egg, and these two items, these two processed food or the meat which is available now, has very high content of estrogen and progesterone. And what will happen is when you are consuming this, automatically you will start to have craving towards the sugary stuffs. You want to eat this and that. This is where the craving shoots up when these two hormones are irregular. Okay, so obesity is another big issue. When anyone is obese, absence of disease, whatever, straight you can tell them they are the risk patient, and they are high risk of any disease. Okay, anyone is obese, remember that. Okay, your high chance, high risk. Maybe in the teenage, young age, 15, 18, 85, whatever age, like 30, 35, they may not have any disease. Okay, they feel very good, very healthy, very active, doing now. But when you reach the age of like 45, 50, or 55, with the same consistency of the obesity, okay, they have not been reduced. That's where a lot of things can come in. Okay, prostate cancer for men or female, and different types. Okay, so the obesity is something that shows that unwanted food is being regularly consumed, and also too much of sugar is going in. So hormonal imbalance also takes place. So there are a lot of reasons for them to consistently maintaining the high fat volume in the body. Okay, so this is the trans fat, the covering up fat. There's so many different types of fat. Okay, visceral fat, and all this is so dangerous. Doesn't mean absence of disease is healthy. So anybody who is just fat, straightforward, take it as non-healthy factor. Work towards losing and trimming and coming down. And this is very important. Okay, you see, when you have too much of fat, your body do not have very high metabolic rate. When you have large amount of muscles, when you have less fat, you have more muscle, so your metabolic rate in your body is much better and more efficient. Okay, so this is where the fat people, and you see sometimes the thin people, they are very thin, but they can burn more compared to the fat one. The fat ones, they eat very little. Even that little is been too much for them. Why? Less of muscles, too much of fat. The metabolic rate will become very low. Okay, so the another people is lot of muscles, very less fat. They will eat even more compared to the fat one, but the metabolic rate is even higher. They can tend to burn more calories compared to the another fat one. Okay, this is the reason. Okay, how DXN can help? Okay, so DXN, how it helps is the full range of DXN products is based on food. It's a superfood, multifunctional food, and it's highly nutritional food, and it comes without chemicals and natural. So change the lifestyle. Okay, here DXN products do not cure disease, do not cure cancer, but it change and module your body towards a healthy lifestyle. So integrate everything. Okay, change your coffee. Okay, change your enzymes, change your juice, spirulina, and everything. Whatever you have in DXN, integrate, buy that in DXN, and when you do this, you are doing an wholesome changes. So this will even gives you a better input of nutrition. You see, You may eat anything which is in different color, in different formula, in different shapes and so on. But all these, your body do not identify. You may eat biryani. You may eat char kway teow. You may eat, nasi ambeng or whatever. But your body do not recognize all these stuffs. Your body only looks for nutrition from what you add. Remember, okay? So when it goes only to your point of view, your vision, your eye, it looks different menu, looks colorful, looks nice, tempting. The moment it passes through, it goes to your esophagus, goes down to your stomach, and that's it. Your body do not know anything. It will digest and it will process and it will look for nutrition. What can be used and what cannot be used. Whatever cannot be used will be transported out. Whatever can be used will be transported in. So nowadays the wastage is too vast, too much. What we are eating is too less. So when you take these DXN products, they are full amount of nutrition which is given. Okay, especially the spirulina comes with 300 fantastic nutrition inside, essential nutrition, which is really, really important. And then comes the Ganoderma lingzhi, in the ancestors that's been using for thousands of years, and we should be very lucky to have Ganoderma in our hand, because this king of herb and this mushroom, not many people know about the benefit of Ganoderma. Okay, it is extremely good. You see, when a little story I want to share with you. Okay, I'm into bodybuilding. I do a lot of weightlifting, this and that. That was like 10 years back, 12 years back. Okay, for past 5 days, I've attended a fitness training course. Okay, I just got this course. I wanted to go and see what is really happening, and then what has happened is I used to do deadlift for 220, 250 kg before those days. Okay, and they just stack up that day in the training about 120, and I've never been carrying any weight for past 10 years. Okay, not as heavy as that, maybe 10 kg, 20 kg very occasionally, and fast for 2 years. Even in the COVID time, I didn't do any weightlifting. Okay, I tried. Okay, even the one guy that's so huge, so big, he tried. He only was able to do 120. And I tried it out. It was so easy for me to do that 120 kg deadlift in 2 reps. That shows what? My food is good. You see, I take the entire range of DXN products, spirulina, Ganoderma, cordyceps, potensis, this and that, and drinks about 4 to 5 coffee, sometimes goes up to 7 coffee, even 10 coffee per day. So when I put this video in my group, and everybody says what? Because of DXN you can carry. They never tell me that because of me or I'm good or what. No, it is because of DXN. Because of DXN products, that shows our product is so good. In fact, that is the truth. Okay, I was so amazed when I could just lift it up like that, so easy. I said, oh my God, that means I am taking the right stuff. Okay, everybody's health is in your hand. What you eat, what you are. Okay, even in that process, when I go, I learned a lot of things, but people do not really understand what is food and what you should be consuming, what you shouldn't consume. No, people are pretty lost. So we here got to really go out and educate people what they should do. And the DXN products always the best, because no one knows about lingzhi. Nobody knows. Nobody talks about. You see, there was national athletics in world champion record holder and all in that training, but nobody knows about Ganoderma. Nobody knows about lion's mane. Nil. Isn't that a waste? And also they don't know anything about spirulina either. You see, so you guys sense a very wide chance, and you guys got a lot of things to do. Comes to quality, there is no question. We have everything more than what we need, especially the ISO 14001 and 901 and 17,500, if not mistaken. We have everything there. Okay, so we are more than qualified. That is why we are globally operating from Malaysia. 270 over countries, product availabilities. For 75 countries, we have offices. More than 12 countries, we have factory. 29 years operation, soon going to be 30. So how such a company can have this? And we are the only food manufacturing local based company have the Australian Government Department of Health has given TGA. So we should be very proud, and we're having whatever is needed as a food company. Okay, so thank you so much. Well, let's go to the Q&A session. Okay. So yeah, Catherine, Julie, you can let me unmute you. Yeah, you may unmute yourself.
Doctor.
Yes, good morning.
Good morning. Good morning, doctor. Okay,
Yeah.
Doctor, my question is, I have few friends that are staff nurses in the hospitals.
Okay.
So when it comes to mammogram, they always tell me that if you don't have a background of cancer in your family and things like that, actually mammogram is not really necessary, because mammogram will disturb the good cells. And when you do mammograms, the good cells, the compress is there, the cells are damaging the cells. So they say that it's actually not good, Catherine. So what is your view on that, doctor?
Okay, my point here is, what I would say is, okay, yes, it is a compress, you're going to have a lot of pain and this and that, all that is true. But you see, nowadays, the food is so bad. It all depends on your lifestyle. If you are confident enough, you don't have anything. If you're confident enough, you are free of cancer, you are very good, your lifestyle is so good, you eat really well and all, you do a regular check on your routine, you feel there's no lump, then there's no bump, nothing. You feel confident, then, well, that is good. Okay. But if you have a little bit of doubt, there is a lump there. You need to do some investigation. This must have go. That's what I will say. But no doubt it is the damage what the mammogram does is very little. Okay. If it is a cancer there, and that will be even more risk than the mammogram. So see, how much of damage does the mammogram do? The mammogram never do that much of damage that until that the breast going to get damaged, the cells going to get damaged. No. Okay. Which is a manageable risk. The risk is manageable. So I find it is always good to do it. Okay.
All right. Thank you so much, doctor.
You're welcome. Anyone else has any questions? Yes, Anita Devi, you may unmute yourself.
Hello, doctor. Good morning, doctor.
Good morning, madam. How are you doing?
Super, doctor. Fantastic.
Fantastic. Okay. So what is your question, please?
Doctor, today my sister asked this question, doctor.
Okay.
Yesterday she was at fasting, Dr. Ekadasi, the whole day. A gastric problem arises, doctor. So what will add the doctor, the products and DXN products, what we should add, doctor, and how to arise this problem, doctor?
Okay, you see, fasting, there are a lot of people have this problem. You see, when they do fasting, they may have some gastric interruption, or either the gas can be more and all these things. Okay. For some people do have these issues. Okay, this issue comes, you see, when you're going to do a fasting, I always advise them, when you're going to do a fasting, your food prior to the fasting days, 1 or 2 days, take something which is less of chili, less of, all that other stuff, you have to prepare your body to go into fasting, because
Okay.
the food what we eat in one day will not come out of the body. It may takes about 3-4 days to do the rotation, because our esophagus and the colon, the intestines and small intestine, large intestine, the whole thing takes about 27 feet. Okay, so it's not a one day process, so it's a very long process. So this is where the food plays very important role. And also drinking milk and all during this fasting time, it is very, very
Yes.
bad. It will give you a very bad reflux and all. Okay,
Yes,
and this
Doctor.
is very
Yes,
important. So what you can do from DXN is you always can put them on, lion's mane is the best. Enzymes is really, really important. So
Yes,
all
Doctor.
this, you see, if
Okay.
the stomach walls are very strong,
Okay.
you will not have problem. You can hold your hunger. You see, anyone, any human being who can hold or control the hunger, and that
Yes, sir.
shows that you are healthy. If you cannot
Okay.
control your hunger, and some
Yes,
people
Doctor.
when they get hungry, they will tend to get angry. Okay,
Yes.
they get very
Okay.
agitated, they very get mood swing, they very will snap immediately like that. This is
Okay.
not healthy. This is very dangerous. Trust me, I've seen a lot of people. And also,
Yes.
some people will have drastic energy lost if they miss the meal. They will also
Yes,
tell
Doctor.
you, I'm going to faint now. They may not get angry. They will be laughing and they say, no, I'm going to faint. I have to eat. This is also unhealthy body. Why?
Yes, Doctor.
Yeah.
Hmm.
Why? Because you do not have control. You see?
Okay.
So a good body will have more energy during fasting. That's one. Second,
Yes, Doctor.
you will not get angry. Your mood will be very calm, very relaxed, and you'll be
Oh.
able to handle the situation relaxed.
Yes, Doctor.
Say suddenly, for an example, you are driving, you're going to have
Yes,
your
Doctor.
lunch. Suddenly something happened to your car, your tire punctured, or
Oh.
you knock into something, or in front of the road collapse. You cannot drive and go.
Yes, Doctor. Hmm.
And what's going to happen? Don't tell me that you're going to jump, you're going to kick your car, burn your car because you're hungry,
Yes,
your
Doctor.
car flat, the tires flat. No,
Yes, Doctor.
this type of things can happen, and it happens. I've seen people get very agitated, very angry. Sometimes they'll just sleep like they're going to die. Somebody has to run and get them food and this and that. Hello,
Yes, Doctor.
it's only one meal.
Yes, Doctor.
It's only one meal they skip.
Okay.
You see, so all these signs and symptoms is where the body system is not eco. The ecosystem internally, it is not balanced. So they're
Balanced.
having a lot of issues.
Okay.
This is very, very dangerous.
Yes,
Okay.
Doctor. No
So
need
anyone
to-
who are listening, remember, if you have this signs and symptoms, so make sure you train your body that you have a good balance system.
Yes, Doctor.
Okay.
Thank you so much, Doctor. Thank you.
Any questions? Anyone? That's all.
That's all, Doctor. Thank you so much,
Okay.
Doctor.
Thank you. Thank you. It's a wonderful question. Yeah. Thank you so much. Yes, Dr. Puan, you may unmute.
Okay. Good morning, Doc. Good morning,
Good
everyone.
morning. How are you doing?
Very good. It's a very hot day today, very humid.
Yeah, the same here. It was raining a few days, but then today it's really, really past 2-3 days is very hot.
Yeah.
Okay, it's good. Okay, what is your
Doc,
question, Doc?
my question is, with regards to obesity.
Mhm.
So people with, who are more muscular,
Mhm.
they tend to have high metabolic rates.
Yeah.
And they also tend to be, they maintain their body, their body weight is better managed, right?
Mhm.
So what would your advice be? Because I know a lot of women
Mhm.
they don't have good bone density or a good strategy to build up their muscles,
Mhm.
and so that is why they some of them fail to keep a good to manage their weight. I
Okay.
mean, irrespective of whether it is hormonal imbalance or what.
Mhm.
So in terms of DXN products, and also in terms of weight training or whatever, what would you recommend for women to do? Like, say, I know people who are in their 50s or after menopause, they
Okay.
find that they tend to have very the whole muscle, like, it starts to collapse, and they
Yeah.
look much more flabbier. Yeah, what would
Mhm.
your advice be? Thank you.
Okay. So very good question. You see, so what I will advise is, you see, the best way of burning calories. Okay, you want to burn off your fat. Okay, a lot of people have this theory that muscle fat will convert to muscle, muscle will convert to fat, and all that. No, it doesn't do that way. So the fat in the body do not need energy. Only the muscles use up energy. The muscles need nutrition, potassium, magnesium, sugar, glucose, and all these things. So that's where when you eat, you have enough muscle, you can metabolic rate is very high. So if not, and all these things stores, and then it will be convert into your visceral fat. So how are we going to twist and turn and make this go off? Okay, the best is, you can, if you fit enough to walk, I would really suggest walking would be the best exercise for anybody. So how you going to walk is, you can do like the intermittent kind of fasting. This you can say, like, you can walk for a few, like 5 minutes very fast. Okay, like a brisk walk very fast, and then slow down, and then fast slow. That kind of exercise is also good. Or you can do some kind of, like, stepper. You can do step, you can do squats, and all these things. So try to do the total engagement. Like, the leg muscles are the most biggest muscle. So when you do squats, you tends to activate back all the muscles. So activating back the muscles would be the best. Okay, so do it. Don't do drastically. Start with like 5 per day, and then slowly the next day go with 6, and then every day add on 1. You see, times flies very fast. If you were to do it for 3 weeks, it's 21 already. If you can do 21 squats, super fantastic. Okay, the highest calorie burned is like jumping rope, skipping. If the person can do, their knees are good, they think they can jump or anything, ask them to do that. That also is good. Or another system is, they can get the trampoline and jump on the trampoline. That is also beautiful, because anything to do with jumping, you activate your whole lymphatic system, and your whole back, your gluten muscles, your the calf, and every of these leg muscles tends to activate, and it also tends to engage every jump, up down, and so the lymphatic systems activate, your body water systems will start to activate, the rotations and all. So all this is good, they can do. So consistency is the most important, I would say. Okay, a lot of people want, don't weigh, don't measure your weight. Weight is totally, you may not have any reduction for a month or so. Okay, don't worry about that. The thing is, it's not how many you do, it is all about how long can you do. Okay, maintaining the weight, it is not just for a couple of months or couple of weeks. For a lifetime we have to do. So integrate exercise and activity which suits you, your lifestyle. Okay, simple thing. You can use a resistant band, you can use a skipping rope, you can do a lot of things they sell now, which you can put in your handbag. You can keep in your cupboards, in your office. So all this is so easy. Easy things you can do just for 10 minutes a day. So, and at the same time, take care of the food in terms of sugar. Cut the sugar off. Okay. Because you cannot count the calorie. Don't count the calorie. Always practice managing your calorie intake low. The highest calorie comes from carbohydrates, minimum. There's no logic says that rice is bad, other things are good. In fact, the portions plays the role. Cut down the portion, smaller portion, 1 cup or 2 big spoon or something like that. Take more of a clean stuff like fish and this and that, all this is good. And furthermore, our DXN has plenty of things for weight management, and that will help. Our coffees is really mind-blowing. Lemon tea is so good. Micro veggie is superb. Vinaigrette honey is extremely fantastic. Cordyceps, okay, if you're doing anything, starts with muscles. Alternate days also cordyceps will help you to keep your muscles. You see, when I do the deadlift, I got a shock. I can't believe. In fact, when I wanted to carry, confidence is there, but I've never been doing anything for past quite some times. When I lift like 120 kg, like it was so light, it just went up, boom, like that. Then I put it down, I did another one. I said, okay, it's enough. You see, why? The muscles are still good because I take cordyceps. You see, so all these, just give them one, and then we also have spirulina cereal. We have cordyceps cereals. When you do this, the body will start to rebuild back and do a lot of walking. Walking is the best. Then maybe you can walk for 2 weeks and then start some squats. Simple stuffs. So the most important, I say, is not the quantity, the quality and consistency. Maintain this. If you do 10 squats daily, do it for 5 years. You can do every day. You do 10 squats. You can do it for 1 year. Wow, I tell you, that will really gives you a good muscles, good, you will never come big, definitely no. It's not that easy to come big like your muscular, no. But the total body will start to lose weight. You will get into a beautiful shape. Definitely. Okay. Okay, Dr. Puan, I think I answered your question. Okay, do we have any questions? If we don't, then we can wind up the session. Tila, now only you're coming in. Anyone? Madam Tilaga Palaya. Okay. Yes, Dr. Puan?
Doc, can you actually give us some tips about the use of virgin coconut oil in terms of, I'm just going back to flexibility,
Okay.
Yeah, body flexibility and virgin coconut oil. Yeah. Thank you.
You see, this virgin coconut oil, practically, why it's good. Okay. Among all the oils, always they get these questions, which oil is good? Okay. Is it olive oil good? Is this oil good? That oil good? The only one oil that human body can digest in the mouth and in the stomach is coconut oil. None of the oils is digestible. So when we take any food, the food has to digest, convert into nutrition. Simple. Okay. We don't want to go too deep in, what is in this, what is in that, how this can work, how that can work. No, we don't want. That's why the science is so good in confusing people. Okay. They will put all the mumbo jumbo in front and convince people that this is good, that is good. This is what is happening out there. See? So what I will say is, okay, Why coconut oil is good? Because it is digestible. For an infant, for a baby, you can add coconut oil, okay, or even coconut milk into the food. You give the baby will not have diarrhea. You can even you can add coconut, okay, because the coconut is what will get into our lipase, and it can become digestible. So the nutrition where it goes into the system, it has the balance of omega K369. So it also balance up the muscles, it fits in the muscles, and it also nourish our intestine, our stomach wall, the microbiome in our stomachs and the flora in our stomachs gets very, very healthy. So when this department is healthy, immediately the synovial fluids in our joints and all our tendons, ligaments get built up. So you can have good texture of skin, good muscles, good tendons, and all these areas will get fixed. Simple. Like olive oil. You see, trust me, in Malaysia, I would say 70% or 80% of olive oil, it is fake. Okay? It is not a pure olive oil. In Malaysia, okay, we have very low quality. Don't trust the label. Okay? Now we have the biotech engineers, these people are very good in coming out with producing something look like something. They are good in that. Okay? They will make a coconut oil of this oil. They were putting in all the fragrance. It looks really like coconut oil, but it's not coconut oil. And this is what they're doing. Okay, so olive oil is out of the questions. If you have good olive oil, maybe you can rely sources of olive oil. It is not for cooking. Okay, it is just to put on the salad and then you mix and take. And that is olive oil. But the only coconut oil can take in the temperature, any temperature, and it will not break. And also ghee also is good. All the oil, sunflower, this, that, no. Okay, the take is no, that's it. Okay, it is not good oil. Seed oils are worst, very high in oxalates, and it is not safe. Okay, sunflower seed, this seed, that seed, seed oil are not safe to be consumed. Okay, so those days we have been using a lot of coconut oils. So medicinal purpose we used this and that a little bit here and there. But nowadays the problem is the moment somebody says black seed oil is good, finish. Everything goes on black seed oil. We say this is good, finish. Overusing. So seeds is not good. Very, very small amount, but better not. Yes, in Malaysia we have so much of coconut. Coconut is the best. So you can use virgin coconut oil, or you can use any other coconut oil, or you can use coconut directly into your food, and that is what the best. If you are staying in a country where you don't have coconut, and that is different. Okay, so in Malaysia we are lucky, use a lot of coconut, and it's so cheap, it's not that expensive. Okay, you see, I have only 2 adults and 2 kids in a house. I use about 12 coconuts per week. Okay, and every 2-3 days I will grind 5 coconuts, and today only I got 5 coconuts, and this will finish in 3-4 days. Okay, even I sprinkle some coconut in my rice. We'll make it into smoothie. We use coconut milk. If you use for chutney, for cooking and everything, coconut is being used daily basis. So use coconut. It is very safe. Okay, go and do research, Google and all. You will get the answer. Okay.
Thank you, Dom. Yeah, thank you very much.
Thank you so much. So that's why today, where in the training, there are so many funny people there. One so scared of sugar, one say no, I don't take this, one say I don't take that. And I'll just sit and listen to all these people. I didn't do give any remarks. I didn't share anything because I'm just a participant there, and I don't want to say that I know this, I know that. We just learn and unlearn things. So there's one lady, she very careful. She takes Quaker oats with milk, with berries, fantastic, based on book. But her problem is she got slip disc, she got spinal problem, she got bone problem. And why all these things is happening? Because there's no fat going into the system. Because she's taking milk. So there are a lot of changes need to be done. Too much of oxalates. So what is going to happen when this person reach 65, 67, 70? Major rheumatoid arthritis will come and attack, and all these things going to come. You will lose the synovial fluids and everything. Then they will say when I was young, I can climb mountain. Now I'm old. Look at my picture. You see, we don't want all these things. We have to live healthy at the golden moment. I always tell people the golden moment is when we reach 60. All of us will come to that point of time. And not that this time we have to manage our disease. No. Another gentleman is 62 or 63. And he's an Ironman. He does a lot of running and all. He's active. But with hypertension. Why? Daily breakfast is bread, Quaker oats, milk. Never take nasi lemak. He says nasi lemak is very bad. And takes toast bread, egg and this and that. Based on book. Yes. The consistency of his running and the ability of doing all this is because he has trained the body to do so. But that has given him why the hypertension. So when you have high pressure in the system, that shows the system is having malfunction in some areas. So that is where internal pressure has been built up. Okay. So you see, but how to tell these people? They will never listen. All right. And they also don't take this, don't take that. They have so much of theories based on book. I always tell something to everyone. Okay, what is simple? Don't believe any doctors, including me. The other doctors out there, don't believe Dr. Lim. Don't believe anybody. Believe your great-grandfathers, your own family, your ancestors who did what they did, you do that back. 2 generations back, you do. They lived a good life. They have never been to gym. They have never had a sports shoe. They don't know what is cycling. They cycle because it's external transportation. Now they buy a cycle, cycling 70, 80 kilometers around here and there to maintain health, fitness purpose. Fitness has become a sports. Sports has become business. It's all to make money. So see, the whole world has been different. If you were to take 100 years back, do you know what is sports? No. You know what is sports shoe? We don't have one. You only have slipper? Yes. Proper shoe? No. And they are the one who live the healthy life. They have diet? No, I don't know what is diet. I only have food. Intermittent fasting? I don't know if fasting, I don't know what is intermittent. Now, there are so many terms which confusing us. Life has to be simple, has to be enjoyable, and has to be healthy. Definition of health in my terms, very simple. You have to jump out of the bed early in the morning, wake up around 7 o'clock, 6:30, 6 o'clock, boom, look forward, wash your face, drink 1 cup of water, that is up to you, go for a walk. Look at the sky from darkness coming into the brightness. Then, boom, you are healthy. If you look at the sky, it is so difficult for you to wake up and you're finding like you're rolling and rolling and rolling. The alarm is banging and banging. You're snoozing and snoozing and snoozing. We are the most unhealthiest people on the earth. Train yourself to wake up early, and this has to be a routine. Go to bed as fast as you can, early as you can, maybe 12 o'clock, wake up 6 o'clock, 7 o'clock. At least 6 o'clock is the best. That's why it's still dark. You can see the darkness to brightness. That is the most beautiful time. When you walk around 6 o'clock and the 6:30 comes and 6:45 comes, the brightness comes. I tell you, it's so superb. If you are in the beach side, it's even much excellent, mind-blowing, beautiful. If you're in the park, it's okay, doesn't matter. Then you see the energy, the cosmo energy will transfer, things will start to move, the energy in the cosmo will get less because all the moving parts will start to use the energy, and we cannot tap as much energy as we can. So even much earlier is better. That's why the meditation is always recommended is 5 o'clock. Why? Abundance of cosmo energy is out there. You can tap them. Okay. When you go out, at 7 o'clock, 8 o'clock, and everything's been used up, and there's so many people. So you have less cosmo energy out there. Okay. This is a little extra, which I know, I've read, I've been doing, is good. Once in a while, we don't get up, and it is okay. A human being, right? We like to be lazy, and then it's okay. Try to do it perfect at least for 70%, 30%. We are lazing around there and here, and this is fine. It's fine. At least 60%. Something. We can make it perfect a day. It don't have to be, ISO standard, so, but at least something. Okay. I believe that, we shared a lot of good information today. Thank you for the beautiful questions been asked. Okay. So, share this video to all your friends, and they will need all this information. And being healthy is not absence of disease. It is not being in shape. Okay. It's not having masculine body and all. Okay. So we have to pull through of being healthy until 70, 80, 90, 100 more. And the golden movement is after 60, we have to free of disease, don't manage disease. We don't want to manage bad things. Good things to be managed, bad things not to be managed. So disease is something bad. We shouldn't be managing it. Okay. So stay healthy. We'll end the show now. Okay. The session. Thank you so much. And the YouTube channel is here. My YouTube channel is DRFIRG. You can see from the screen here. This one is the link. Okay. DRFIRG. You put in the YouTube, it will just pop up there. Okay, thank you so much. Let's see you on the next session.